Hi, Suzanne Chan from Mom Confessionals, and today we are putting on my medical hat. I am currently a labor and delivery nurse, and I also was a postpartum nurse at one point. I actually started off as a postpartum nurse, and just to give you a little bit background history, I actually had 3 C-sections. So we are talking about C-section recovery and tips that I have come across and things that I have tried myself, and I kind of wanted to pass that along because a C-section is kind of scary. It's major abdominal surgery, and a lot of people aren't really prepared for it. Some people think it's an easier thing to do because you don't have to do the labor process. I've got the pluses and minuses of both. I mean, I think having a vaginal delivery is one of the most beautiful things I've ever seen in my entire life, and I love living vicariously through my patients, and it's just a wonderful, wonderful thing to experience. But obviously that's not for everybody, and sometimes you don't really have a choice and you wind up with a C-section, and that's totally okay too, because at the end of the day you have a happy, healthy, beautiful baby, and that's all that really matters. So again, C-sections are rough. It's surgery. You're cutting your stomach open, and what's crazy is you're actually awake for it most of the time. There are certain circumstances where you are not, but if you're lucky and you just have a very routine standard C-section, you're going to actually be awake for it. What's going to happen is they're going to give you a spinal epidural or put in a spinal. Some people have a combo if they were laboring beforehand, but other than that, you're going to be numb pretty much from your just right below your breasts and down all the way through for a certain period of time. And that's really great. So after you have the surgery, you're usually sewn up, you've got a bandage of some sort, either it's staples or sutures or dermabonds. There are many different ways of closing up, but you're gonna wake up in some sort of pain. Many a times the anesthesiologist will prophylactically give you some pain medication before you head out. You'll be given different pain medication options when you're in recovery. Some of it's going to be oral form, some of it's going to be IV form. And one of the biggest advice that I can give to any patient recovering from a C-section is take your medications. Take your medications so that you can allow your body to rest and try to heal, and that you can enjoy your baby. If that's the biggest advice I can give anybody who's recovering from a C-section, is to do just that. Take your medications. You can always taper down. There's never a problem with that. If you do choose to opt the oral medication route, you're going to start with the stronger medications, and usually it's going to be mixed with a little bit of a narcotic if that's of your choosing. And all of these medications that they offer you are perfectly safe for breastfeeding, okay? There are certain medications that anesthesia will give you that are contraindicated, but they will of course absolutely let you know, and those are more in the more emergent situations, and if you needed to be put to sleep during your C-section. Aside from that, all of the pain medication options are pretty safe for breastfeeding. And what you're going to do is, I always say, is start with the strongest first. Start with the strongest first, see how you feel, and then you're going to kind of alternate with some of the lighter medication options that they give you. What we offered at our facility is Percocet, and I started off with Percocet, and I alternated between Percocet and Tylenol because Percocet and Motrin, because Percocet actually has Tylenol in it, also known as acetaminophen, and I kind of alternated between the two, and then eventually I tapered off just to between Tylenol and the Motrin, which actually was very effective for me. But one of the other things that I can tell you guys that you need to do is get up as soon as you can. In some facilities, you might still have a Foley catheter attached to you, draining your bladder, or other things going on. But even so, you can still walk around with some of these things. And you're obviously going to be at the discretion of the nurses who are with you and situationally aware of what exactly happened to you. But a majority of the time, they will allow you to get up, and they will encourage you to get up within a few hours after your surgery, because you're not open. It's not an open wound. It's closed. It's either sutured or stapled or some other method of closure, but it's also bandaged up as well. Get up. Get up and walk, because what does that do? That gets your blood flowing, and the blood flowing is really great for helping to heal. You're going to get that blood moving along, rushing to the site, giving it more clotting factors and helping it to heal, all of those other biological stuff that I won't get into, but it's going to help you heal. And you're also going to feel so much better. The other thing you might notice after you have a C-section is that you're really swollen, because they pump you up with a ton of fluid during your surgery. Okay, and that's to keep your blood pressure up and other reasons that they do it as well. But you're gonna feel swollen. You're gonna see it in your legs, maybe you're gonna see it in your face. But the more you walk, you're actually gonna force all of that excess fluid back into your bloodstream, get it moving along, and you're gonna start peeing it out. You're gonna start to notice that you're really putting out a lot of urine. One of the other things that a lot of patients experience after a C-section is gas. And gas is painful. It's gonna feel really painful. Some people feel it all the way up in their arms and shoulders. And that's kind of, you're like, how do I get rid of that? And you're like, I gotta toot. You've got to toot. And what are some of the things that are gonna help you toot is walking around, but you could also drink some tea, drink some ginger ale, a lot of ginger ale, a lot of soda, and just get walking around, okay? You can take some medication if you'd like. They're gonna give you some Mylicon, which you're probably familiar with if you've had children. Sometimes you had to use some little gas drops. Or they can give you some Colace to help you poop so you don't have any additional pressure or strain, which is what a lot of patients have said to me. They're always afraid because they feel like they're tearing, which brings me to my other tip. So obviously laughing's gonna hurt, coughing's gonna hurt, all those things that's gonna make you feel like you're tearing your stomach wide open. The best thing I can tell for you is to use some counter pressure. So if you're home or you're around something that you can grab, like a pillow, that's probably the most gentlest that you can use. You're gonna use that, you're gonna push against the incision. It might hurt initially, like a slight twinge, but you're actually offering it counter pressure. So you're gonna press against that and you're gonna cough, and you're not gonna feel like it's tearing. You can laugh, belly laugh all you want, and that's gonna be awesome because you're gonna have that counter pressure against it and you're gonna feel so much better for it. And so if you're out and about, your hand will do. Just the palm of your hand and press very gently and press down and give a little counter pressure. And that's really, really gonna help. Again, get up as soon as you can and walk. Take your pain medications and use some counter pressure. So that is the best advice I can give you for the C-section recovery. And I've had 3 C-sections. So remember, my first one wasn't anything in the medical field. My second one, I was in nursing school and just getting started and learning. My third one, I benefited from the knowledge of being a postpartum nurse and as well as being a former C-section patient twice. And I actually learned everything I was teaching my patients as a postpartum nurse actually works. So listen to your nurses. They know what they're talking about. Get up and walk, drink your fluids, and take your pain medication, and just use counter pressure and enjoy your new baby. All right, thank you. Until next time.